All right, good morning, everyone. I would like to introduce Scott Licala with Ability Medical Supply and Jarrett Rolls with Numotion, and highlight that both companies are partner in our equipment loan program. So thank you very much to both of you, and the stage is yours.
All right, good morning, everybody. We're happy to be here today to talk to you about how to navigate the evaluation process to get started with powered mobility equipment, and also to explain ALSA's equipment loaner program. My name is Jared Rolls. I'm an ATP with Numotion here in Orlando, and I support Dr. G's clinic at Orlando Health. In our expo booth and in the Learning Lab, you'll be able to find and chat with some of the other ATPs that work for my company as well, that support some of the other ALS clinics around the state. Numotion is a national company. We have 7 branches in Florida, and we support the entire state. And we're also a national company with 43 offices in 43 states, and we're a statewide and a national partner with ALSA.
Good morning. My name is Scott Legal, and I'm an ATP and CRTS with Ability Medical Supply. I'm also the Director of Clinical Operations. I support the clinic at Holy Cross as well as USF, so you will see me there if you attend those clinics. Ability Medical Supply is a statewide company, and we are statewide supporters of the ALS Association as well as partners with the equipment loan program. And we're going to go ahead and start talking a little bit about powered mobility. And the first question we usually get asked is, when is it time? What are we looking for as far as making that decision to start that process? And of course, always keeping in mind that that process, it doesn't happen overnight. We usually expect it to take anywhere from 2 to 4 months. So keeping that in mind, we start looking at a couple of different points. 3 most important, one being safety. If you have had falls or your risk of falls has increased, we think it might be time to start talking about assistive devices. And in this case, we are going to be talking about the powered wheelchairs. When it comes to energy conservation, if it is taking you more to get to and from within your home as far as completing your daily tasks, your ADLs, and it's becoming more taxing to do so, we might want to start talking about mobility assistive technologies. And the other is just going to be overall independence. If you have decided to stop doing certain things, or you're finding that you can't do all of the things in your normal day that you would like to accomplish, whether it be because of risk of fall, fear of fall, the energy that you're expending to do those things, and you've just decided to maybe allow somebody else to do those things for you, or give up on certain tasks that you would normally do yourself. These are the different things that we're looking at, that we're going to start talking about the idea of using an assistive device. And certainly if you're already using an assistive device like a cane, a walker, or something simpler, but it's becoming more difficult to do the same things throughout your average day, then that leads us down the path to start talking about our power wheelchair. And Jared is now going to explain that process and the fine points of how that's going to occur.
Yeah, thanks, Scott. So let's kind of talk about why it can take 2 to 4 months. So navigating the process can be a little bit tricky, and that's one of the things that we're here to help with. So each insurance company that we have in the state and in the country has specific paperwork requirements, but that's all handled by the supplier or the company that you choose to work with. So the process typically starts with a referral or a recommendation from your doctor for a physical or an occupational therapy assessment to discuss your mobility needs. A lot of times that can come from one of your visits at clinic, but it's important to know that most times that's going to be a complete separate visit from your clinic schedule, and it may or may not be with somebody that you've previously met. So basically what happens is we all get together. It's typically the ATP or the supplier, the physical or occupational therapist, and you and any of your family members that choose to attend. And we get together and we discuss everything, like Scott was saying, your fall risk and safety concerns, your strength, range of motion, how far you can walk. We'll talk about things like your strength and your endurance in the morning versus in the afternoon. And all of that will come together with the beginning of your mobility assessment. In my clinic, we also have we have demo equipment. so we can look at and discuss all the possible functions that the wheelchair can do, and things that we have available to try. So it's also important to know that everything on the wheelchair is incredibly modular and can be changed at any time during the process. So if 6 months down the road something is different, then we get medical documentation to justify the need for the change, and we just go ahead and change it. Part of what the evaluation will also do is the measurements will be taken to make sure that it's a proper fit and that the function will work exactly the way that we need it to. After that, the clinician will finish the paperwork, and then it'll be shipped off to insurance, which typically they have up to 30 days to make a decision. Hopefully that they won't do that. But there are other things to talk about when it comes to some products that may or may not be covered by the insurance that might be helpful for you. For instance, seat elevators, and we can kind of talk about that if anybody wants to jump into the learning lab afterwards. There are some products that are very medically necessary in our opinions, but the insurance company might not agree. So that ends up being an out-of-pocket expense, or we have some associations that we can also work with for some alternate funding. Once we get the approvals and everything is good to go, then we will order the chair. With the manufacturing delays and the raw material shortages that we're currently experiencing, some of the manufacturers, I'd say most of the manufacturers actually that we work with, are experiencing delays. So something that we might have been able to get in 2 or 3 weeks is now taking 4 to 6 weeks, so that can delay the process as well. So again, the typical time frame from evaluation to delivery, just like Scott said, can be anywhere from 2 to 4 months. And that's one of the reasons that it's important to get started, because we would prefer that you have the chair when you're ready to use it, not be playing the waiting game, once that decision has been made. Delivery in my clinic also is a separate appointment. You have the option to take receipt of the chair at home if you wish, but most of the clinicians that I work with, at least locally, agree that it's better for the clinical outcome to make sure that everything we discussed at the original evaluation was on the chair, and that the plan we had in place was actually working and appropriate. So that's something at the end of the evaluation too, depending on your mobility needs and the urgency, then that's when we can also start the discussion about the equipment loaner program and how to navigate that. And I'll kick that over to Scott to explain that to you.
Ability Medical Supply and New Motion are partners with the ALS Association Florida Chapter's Equipment Loan Program. And what that basically means is we house, maintain, and move the equipment that's been donated to the association. If something is no longer needed, it can be donated. We are generally talking about DME, which is going to be canes, walkers, wheelchairs, power wheelchairs, hospital beds, transfer devices like Hoyer lifts, shower chairs, other durable medical devices. We do not take and house in any soft goods, so any like chucks, diapers, things like that do not come through the program. Communication devices and respiratory devices are done through different loaner programs, so we focus primarily on our mobility, transfer, and safety needs within the home. The devices in the loan program can be borrowed as needed and utilized as long as needed, and there's no charge to the association or to the end users who will be receiving those devices. This program is administered by our companies as a courtesy, and basically what happens, a request will be made, usually through the clinic, your clinicians. It could be directly from you if you've noted that you have a need, but it's going to go to your regional care manager. So whether it be Marixa, Tina, whomever you work with in your area, will file that request and send it to the ALS Association's office in Tampa. And then they'll turn around and send a request out to either Ability Medical Supply or New Motion to deliver that device if it is available. Once we, as the company that's going to be delivering it, receives that request, we'll identify whether or not there's an appropriate device available based on your size and needs. And if so, we'll go ahead and schedule that delivery and get it out to you. Once it's delivered, we'll go over any training that may be involved and make sure that it is set up properly. And you will be able to utilize that equipment for as long as is needed. And when you are no longer able to use it, if you're no longer using it for any reason, you'll just make a call to us to come pick it back up, and we will do so. The equipment that's in the program, like I said before, it can be as simple as a cane or a walker up to a complex rehab power wheelchair. And it can be utilized in situations where we are in that wheelchair process, for instance, and we need something to cover the gap between when you've been evaluated and when you receive that permanent device. It can be utilized in situations where there's no insurance coverage, different things like that. But we do have a great deal of equipment, and if you're ever unsure or you just want to know, you could always get in contact with one of us as the supplier or your regional care manager. Let them know what kind of issues you may be having, and we can see if we can come up with any solutions. Especially important with some of the transfer devices and bath safety, because in a lot of cases, those are not covered by the insurance or not fully covered, where you can get manual equipment versus the powered equipment that we have in the loan program. So it's a great resource that's out there for you. And if you ever have any questions about it, we'd be happy to answer. We're also available in the Learning Lab after the sessions end. So if you have any more specific questions about the power wheelchair process, or anything to do with the equipment loan program, feel free to jump in and get in touch with us, and we'll do the best we can to get those things answered. Jared?
Yeah. So we'd like to open it up. If anybody has any questions, we'd be more than happy to answer anything that's on your mind. I think they can just type it right into the chat.
Another quick point to make, going back to the evaluation process, the evaluation is also going to include a home assessment where we'll be able to kind of get measurements of your doorways and passages and look at how you're accessing the home. We want to know if there's any steps or stairs or architectural design like sunken living rooms, anything that's going to make the use of the power wheelchair within your home difficult or problematic, and that'll allow us to make recommendations as to whether anything needs to be done. It can be as simple as maybe the placement of a ramp or the shifting of the way your furniture or throw rugs are in place. We do not like throw rugs. And it can be as complex as saying you might have to have a door widened or a door removed, hinges changed. But as part of the evaluation process, we do want to make sure that the devices we're recommending are actually going to work within your environment, within your home, so that they are able to enhance your quality of life and make sure that you are safer within your home and not work against those things. So again, if there's any questions in regard to access within the home in relationship to the equipment you're receiving, we'll be able to answer those as well.
Good point, Scott. And this, the evaluation isn't necessarily just mobility based. There are a lot of questions that pop up. How do I transport my power wheelchair? What do I do if I want to travel? And all of those can be addressed as well. And both of us have, I'm sure Scott has an entire list of referrals and places that we can send you to discuss mobility vans, to discuss home modifications, to discuss ramps, things of that nature. So like Scott said, it's a very comprehensive evaluation because it is part of our responsibility to make sure that what we are providing you is going to solve your mobility needs, but also be able to, like Scott said, fit inside your home and be able to, get you to and from the doctor's office and to visit with family and all the other important things in your life. So the whole evaluation process is very comprehensive. Okay. Well, like Scott said, we'll both be available in the Learning Lab. We also have other representatives from my company around the state that will be present in the booth and the Learning Lab for the rest of the day. So if there's any questions or if anybody's interested in specifics, we will obviously be here and available for that.
And if anybody has any questions immediately, they can go right into the chat box on the right side of your screen, and we'll see if we can get them answered before the session ends. Thank you, Jessica.
Scott, do you have
Jared?
any comments? Sure, yeah, I can.
Yeah, there are a number of manufacturers that make rehab power wheelchairs, and a rehab power wheelchair is going to be an expandable or adaptable chair that's above and beyond what you can get with what we'll call a different names, Group 2 sit and drive, basically a car seat on wheels. The rehab power wheelchair is going to have a lot more functionality. It's going to have dynamic seating, the ability to accept tilt in space, power recline, power elevating legs, power adjustable seat height, things like that. When it really comes down to it, there are, like I said, a number of manufacturers. There are about 4 major manufacturers. And when we really get in there, there are pros and cons to each. There are features that some have that others do not. I personally tend to lean on the Permobil and Quantum products pretty heavily. They seem to be the most adjustable and adaptable, in my opinion. And from that point, it's going to be in the interview or the assessment process, learning what your needs are, how you're going to utilize the chair, how it's going to access your home, and deciding whether or not there's a feature or a function that one has and the other doesn't, or the pros and cons between, kind of leaning into which one we're going to end up going with. And then, of course, a demo is going to be done. It's where you can actually see, drive, and operate that system to make sure that you're comfortable with what you're going to be receiving. Jared, anything to add on that?
Yeah, I agree with Scott about the manufacturers that are most commonly used in our clinic. It's definitely Permobil and Quantum. One of the reasons for that is they are they're very close association-wise with the ALS Association. They both have foundations that can assist with products that are with parts that may not be covered by the insurance company, seat elevators specifically. They work closely with the Gleason Foundation as well to assist with getting those items covered and off of your financial burden. Quantum, for instance, offers some other parts like an attendant control, for instance, which typically would be $450 or $500 and not covered, but it's an extra joystick that goes on the back of the power wheelchair, so somebody could move it for you or move it to you, so you could transfer in it without having to stand and drive with the joystick next to them. So it's a couple things that sound maybe small and not important, but do make a very large difference in your day-to-day life and in caregiver assistance. And so we tend to stick towards the people that also help take care of our people as well.
Very true.
The 2 companies that we just talked about were Quantum and Permobil. And there are other manufacturers that we use as well. Sunrise Medical has power wheelchairs, Invacare has powered wheelchairs. But again, Quantum and Permobil seem to typically top the list.
Yes, Patrick. There are people who are diagnosed and never end up needing a power wheelchair. It is a possibility, but we cannot say for certain how somebody's path of their diagnosis is going to go. When we transition to the power wheelchair, we did talk about that in the beginning of the program. We could definitely get back into it in the learning lab, but the broadcast is being recorded, so it can be reviewed. But there's no way of knowing for certain that someone is going to need a power wheelchair. So we look at those markers with energy conservation, safety, etc., and go from there. I believe the session is ending, so we're going to have to go ahead and close. I hope everybody has a great day and the rest of the symposium. But please contact us in the Learning Lab if you have any further questions.
Thank you, everyone.